So what exactly is PTSD? It is a disorder resulting from exposure to a major stressor, with symptoms of anxiety, nightmares, poor sleep, reliving the event, and concentration problems, lasting for more than 1 month. Symptoms of PTSD may not even occur until 6 months or later after exposure to the major stressor. PTSD occurs when the symptoms of ASD last for more than 1 month. ASD is acute stress disorder. Symptoms of acute stress disorder include anxiety, dissociation, recurring nightmares, sleep disturbances, problems in concentration, and moments in which people seem to relive the event in dreams and flashbacks for as long as 1 month following the event. ASD is the severe stress disorder suffered by people after 9/11 and Hurricane Katrina. Women have almost twice the risk of getting PTSD than do men, and the likelihood increases if the traumatic experience took place before the woman was 15 years old. In children, severe PTSD has been linked to a decrease in the size of the hippocampus. These results were published by Victor G. Carrion and Carl F. Weems in 2007. Because the hippocampus is important in the formation of new, long-term declarative memories, a decrease in its size may have a detrimental effect on the learning and the effectiveness for treatment for those children. Exposure to combat may be considered a predisposition to PTSD. The rate of PTSD that has been self-reported among combat-exposed military personnel has tripled since 2001. Therefore, it is clear that the problems associated with this long-term stress disorder are not going away anytime soon. In an article published in 1991 by the International Society for Traumatic Stress Studies, post-traumatic stress disorders can be summarized with predispositions using 3 different models. 1. Predisposition due to pre-existing psychopathology. 2. Predisposition due to pre-existing traits or characteristics considered normal. And 3. Predisposition due to pre-existing experience of specified stressors and family of origin. Individual psychotherapy involves meeting one-on-one with a licensed psychologist. Typically, these meetings are once a week for an hour, and they focus on talking about the events, your reactions to them, and a means of getting rid of these effects on your life. Behavioral or cognitive behavioral therapy looks at the way in which a person thinks about a problem and their learned responses to certain triggers associated with that problem. This treatment often uses a combination of exposure, in which the patient deliberately thinks about an event or confronts a trigger, combined with relaxation training, along with cognitive reconstructing and changing one's thoughts about an event. This process tends to desensitize a person's response to reminders of the event so that it no longer carries the same emotional impact. Group therapy can be helpful because it provides a safe and supportive environment in which to discuss a shared experience with others. A group can help you feel less alienated, normalizing your reactions to an abnormal event. Traumatic events can influence the neurochemistry of the body and brain, impacting the person in many ways. Excessive stress hormones can make it difficult to concentrate, relax, or even sleep. They can increase blood pressure, muscle tension, skin conductance, and general arousal levels. It can impair immune system functioning, making people more vulnerable to illness. Fairly often, these changes can lead to depression or anxiety. Medication can be effective in resetting the levels in the brain, It may prove to be very helpful for a period of time.